see an NCLEX RN video based on care for patients with renal disorders. The nurses recognizes that the older adult patient may have a reduced ability to concentrate urine, which is attributed to which of the following? A reduction in bladder receptors, thickening of the basement membrane of the Bowman's capsule, a decrease in the number of functioning nephrons, a thickening of the efferent arteriole. Older adults have a reduced number of functioning nephrons, which impairs the ability to concentrate urine. The nurse should intervene immediately if the patient post-renal transplantation is noted to have which of the following symptoms? Weight loss, hypotension, reduced urine output, fever, reduced urine output, elevated BP, weight gain, hypotension, increased urine output, hypertension, fever. The priority is the combination of fever, reduced urine output and elevated BP, which may be indicative of the presence of acute kidney injury related to transplant rejection. Hypotension, changes in weight and reduced urine output should be evaluated. Increased urine output is expected due to improved blood urea nitrogen clearance and because of the fluids. The nurse includes which dietary information in the teaching plan about the management of chronic kidney disease? Decrease fluid intake and protein intake, decrease carbohydrate intake, increase fluid intake, decrease carbohydrate intake and protein intake, decrease fluid intake and protein intake, increase carbohydrate intake, increase fluid intake, increase carbohydrate intake and protein intake. So here it is important to decrease the fluid intake because people with chronic kidney disease may have a reduction in urine output, causing fluid to build up in the body. This puts the patient at further risk for volume overload. Decreasing protein intake will limit the buildup of waste products in the body, and increasing carbohydrates will provide patient with good source of energy that is lost with the low protein diet. So here decrease the fluid intake and protein intake and increase the carbohydrate intake. The nurse should inform the physician if when assessing the patient with an AV fistula they note which of the following: a loud turbulent bruit, a quiet swishing bruit, a long pitched thrill, a continuous thrill. A normal functioning graft AV fistula will have a low pitched bruit. A turbulent bruit is indicative of an increased force, mostly due to stenosis. So here when you hear a loud turbulent bruit, it should be informed to the physician. The nurse is screening patient for the risk of developing renal cell cancer. The nurse should consider which patient at greatest risk: a 76-year-old African American female, 50-year-old Caucasian male, 24-year-old Caucasian male, 50-year-old African American male. African Americans and American Indians and Alaskan natives have slightly higher rate of renal cell cancer than Caucasians. The exact reasons are unclear. The renal cell cancer is twice as common in men than women. This is attributed to men more likely to be smokers and who have increased exposure to chemicals and occupational hazards. So here a 50-year-old African American male is at greatest risk. The nurse recognizes that genetic counseling is appropriate for which patient? A child with frequent urinary tract infection, an adult with frequent urinary tract infection, an adult with autosomal dominant polycystic kidney disease, an adult with metastatic renal cancer. Polycystic kidney disease is a genetic disorder. Individuals with polycystic kidney disease who are concerned about passing the disease to their children may want to consult a genetic counselor to help them identify the risk for a child developing this polycystic kidney disease as well. Frequent UTIs and metastatic renal cancer do not have an energetic component. So here the nurse recognized genetic counseling for an adult with autosomal dominant polycystic kidney disease. The nurse understands which diagnostic study is more specific in identifying polycystic kidney disease. Abdominal X-ray, serum creatinine level, urinalysis, computed tomography scan. All the tests may indicate renal disease, but a computed tomography or a CT scan will provide more precise results. The nurse correlates which clinical manifestation with the pathophysiology of acute pyelonephritis. Nausea and vomiting, hematuria, flank pain, fever, abdominal pain. All the above symptoms which are stated here except abdominal pain may be associated with the presence of acute pyelonephritis. Pain is usually at the back, groin or flank. So here nausea and vomiting, hematuria, flank pain and fever. What is the etiological process in glomerulonephritis? Tubular necrosis caused by bacteria and antibody reactions, deposition of immunological complexes and complement among the glomerular basement membrane, deposition of bacteria and immunological components within the loop of Henle, destruction of proteolytic enzymes contained in the glomerular basement membrane. Antibody-induced immunological conditions results in the deposition of immunoglobulins and complements along the basement membrane. So the deposition of immunological complexes and complement along the glomerular basement membrane is the etiological process in glomerulonephritis. Which of the following risk factors have been associated with renal cancer? Aspirin use, alcohol abuse, use of artificial sweeteners, cigarette smoking. Cigarette smoking is the most common risk factor for developing renal cancer. Majority of the renal cancers are associated with a history of cigarette smoking or some form of tobacco use. The nurse recognizes which patient has the highest risk of renal cancer. A 76-year-old African American female, a 50-year-old Caucasian male, a 24-year-old Caucasian male, a 50-year-old African American male. Renal cancer is more common in men than women, more common in African American and more common in the age of 50 to 70 years of age. The nurse providing care for the patient post motor vehicle accident with a suspected injury to the renal system anticipates which of the following orders? Perform an ECG, send a urinalysis to the laboratory, administer diuretics, administer antihypertensives. Blood in the urine or hematuria is the best indicator of blunt kidney injury. Microscopic hematuria is easily detected by a simple urinalysis. So send the urinalysis to the laboratory is the intervention to be done. The other interventions would be performed if indicated, that is if fluid overload, diuretics may be given, if hypertensive, antihypertensive would be given, an ECG would be taken if the patient complains of chest pain. Prior to the patient CT scan, which information should be obtained from the patient or family members? A family history of CT scans, time of patient's last meal, list of patient's allergies, time of last pain medication. It's not uncommon for the patient to be allergic to the IV contrast used for CT scans. So it is important to rule out the presence of this allergy to avoid serious allergic reactions such as anaphylaxis. So you need to obtain the list of patients' allergies. Which is a pre-renal cause of acute kidney injury? Acute glomerulonephritis and neoplasms, septic shock and nephrotoxic injury from medications, pyelonephritis and calculi formation, hypovolemia and myocardial infarction. Severe blood loss or hypovolemia and the hypotension related to cardiac events are major cause of pre-renal acute kidney injury. Acute glomerulonephritis, pyelonephritis and nephrotoxic injury are cause of intrarenal acute kidney injury. Calculi can cause post-renal acute kidney injury. Septic shock can cause pre-renal acute kidney injury. Neoplasms may be implicated in acute kidney injury depending on the location. So here the pre-renal cause is hypovolemia and myocardial infarction. Or factors which most often associated with chronic kidney disease include which of the following? Hypertension, diabetes mellitus, malnutrition, peripheral vascular disease, smoking. The most common cause of chronic kidney disease are high BP and diabetes. The risk of chronic kidney disease increases with either or both of these conditions are uncontrolled. The nurse understands that chronic kidney disease is characterized by which of the following? A rapid decrease in urine output with a chronic kidney disease, elevated blood urea nitrogen, progressive irreversible destruction to the kidneys, abrupt increasing creatinine clearance with a decrease in urinary output, confusion and somnolence leading to coma and death. Chronic kidney disease is progressive, not rapid. Irreversible loss of kidney function. Chronic kidney disease is defined as the presence of kidney damage or a glomerular filtration rate which is less than 60 ml per minute for 3 months or longer. Acute kidney injury is associated with rapid changes in urine output and blood urea nitrogen. Creatinine clearance decreases in both forms of renal disease. Untreated or poorly treated chronic kidney disease may lead to confusion and coma. So here, progressive irreversible destruction of the kidneys, that is CKD. The nurse understands CRRT is indicative for which of the following patients? CRRT is continuous renal replacement therapies. So it's for a hospitalized but hemodynamically stable patient, a hospitalized hemodynamically unstable patient, a hospitalized end-stage renal disease patient being discharged home soon, a hospitalized end-stage renal disease patient who is stable but is an intensive care setting. So CRRT is indicated for unstable hospitalized patients who may not tolerate the rapid fluid shift of the dialysis. So Flood is a 35-year-old woman present to the clinic with complaints of abdominal and left flank pain. Ms. Flood complains of increased frequency of voiding and urgency of void and the presence of cloudy urine. She has noticed abdominal distension over the last year. Vital signs reveal a temperature of 101 degree Fahrenheit and a BP of 180/100 mmHg. Continued evaluation of Ms. Flood reveals an increase in abdominal girth and tenderness in the costovertebral area with palpation. Urinalysis reveals cloudy urine and hematuria. Ms. Flood has the classic signs of polycystic kidney disease as evidenced by left flank pain, increased frequency, urgency, hematuria, and abdominal distension combined with hypertension. The diagnostic test IVP confirms the diagnosis. The healthcare provider implements measures to prevent end-stage renal disease. Flood's diagnosis of PKD is confirmed by IVP. Her BP remains elevated at 178/102 mmHg. Laboratory test reveals a blood urea nitrogen of 30 mg per dl and creatinine of 2.5 mg per dl, indicating renal impairment is already occurring. Ms. Flood is complaining of abdominal pain and continued urinary frequency and burning during urination. Ms. Flood's provider orders antibiotics to treat the UTI. She started on an ACE inhibitor, captopril, for her hypertension. Ms. Flood and her provider begin discussions on how to treat her renal insufficiency. A social worker is contacted to help her obtain the resources necessary to manage her medical condition adequately. The nurse talks with her about her anxiety and helps her explore options to deal with this new diagnosis. The nurse monitors for which clinical manifestation in Ms. Flood, who is newly diagnosed with PKD. Hypotension related to fluid shift, bradycardia related to fluid overload, hypertension related to decreased renal perfusion, tachycardia related to fluid loss. Newly diagnosed polycystic kidney disease typically presents with hypertension, not hypotension, due to decreased renal perfusion and fluid overload. There is no fluid loss that could cause tachycardia, and there is no bradycardia associated with fluid overload in polycystic kidney disease. So hypertension related to decreased renal perfusion. The nurse includes which information in the teaching plan about management of PKD. Your BP will normalize when we successfully manage your PKD. Your UTI will not recur if you finish your antibiotic prescription. Staying on your antihypertensive medication is necessary to control your BP. This disease is reversible if you closely follow your provider's order. BP and UTI are chronic problems with PKD. Continued BP medication will be necessary. PKD is not reversible. So staying on your antihypertensive medication is necessary to control your BP is the correct answer. The nurse providing care for Ms. Flood should include which activity into plan of care? Providing cranberry juice at meals to reduce the risk of UTI, frequent range of motion exercise to reduce stiffness due to inactivity, encourage fluids to maintain adequate volume and perfusion to the kidneys, restrict fluid to reduce risk of fluid overload. Fluid overload is a chronic problem due to renal failure requiring fluid resuscitation, so increasing fluid intake would not be encouraged. The evidence supporting cranberry juice as a treatment or prevention of UTI is not definitive. Inactivity is not specifically associated with PKD, so here restrict fluid to reduce the risk of fluid overload. The nurse caring for Ms. Flood incorporates which priority nursing diagnosis into the plan of care? Pain related to irritation or urination secondary to UTI, imbalanced nutrition related to excessive loss of protein in the urine, decreased cardiac output related to dysarrhythmia secondary to electrolyte imbalance, impaired perfusion related to decreased circulating volume secondary to diuresis. The priority diagnosis would be to decrease the cardiac output due to the potential risk of electrolyte imbalance and dysarrhythmias that occur with renal failure. Pain control is always important, but the pain associated with polycystic kidney injury is a flank, abdominal or back pain due to cyst. Nutrition is an important element in relating to renal failure patient. Poor nutrition is not solely due to protein loss in urine and is not a greater priority than cardiac output. Fluid retention, not diuresis, is the problem with PKU and renal failure. So here, decrease the cardiac output related to dysarrhythmia secondary to electrolyte imbalance. Which statement by Ms. Flood indicates that teaching has been effective? I am glad we can control this disease with medications. I am glad we caught this early so I won't need dialysis forever. Getting a new kidney will help even if I develop the cyst again. I have a choice between hemodialysis or peritoneal dialysis. Chronic dialysis is a part of treatment for renal failure that accompanies a PKD. Renal transplantation is a curative option, but the same problem will occur if the patient develops cyst again. So here I have a choice between hemodialysis and peritoneal dialysis, indicates the teaching has been effective. If you understood this video, keep watching for further videos. Thank you.